Thank you, ma'am. Good evening. We'd like to welcome our staff members that are in the audience tonight, and Commissioner Smith's here, and our viewing and listening audience to our third virtual Lee County Commissioners meeting. I guess hopefully we'll see if we get better with practice. Last time was better than the first time, so we'll see. At this time, I am going to call the roll of the commissioners that are online participating virtually. Commissioner Reeves. Commissioner Reeves, are you present? Okay, we'll come back. Commissioner Del Palazzo?
Here.
Commissioner Dodson?
Here.
Commissioner Sharp?
Here.
Commissioner Connect?
Here.
Commissioner Smith?
Here.
And I'm here as well. Commissioner Reeves? Are you here? Commissioner Reeves?
Yeah.
Yes, good. Okay. And as if you would please, we're going to have a moment of silence and then the pledge. After the pledge, if you can maybe mute your phones so we don't experience that background noise, and then just unmute when you need to holler at us. So this time we'll have a moment of silence. Thank you. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you very much. All right. So, additional agenda items.
Whitney, you have an
Yes.
Yes, I have one item for under new business. If we can add a,
Hey, just so they can hear you.
oh, I'm sorry.
That's okay, sorry.
I'll just move over.
Under new business, if we can add a vote to hold a public hearing with the Biotech Center.
Okay.
So we don't have anything for the agenda, just a vote for a public hearing on that.
Okay, thank you. Okay, so that'll be item F under new business. Anything else? Okay. Yes, ma'am.
We need those two items, the budget amendment and the bond council agreement added, please.
Okay, and they're also new, right?
Yes.
Okay, so we have two additional items that sort of fall under finance. That'll be new business as well. So that'll be item G and H. The first one is approval of another budget amendment, and the second is the Wumble Bond Dickinson engagement letter to serve as bond counsel on upcoming financing. So is there a motion to approve the added or the amended agenda?
So moved, Madam Chair.
Any discussion? All those in favor, we're going to have to call the roll. Commissioner Reeves?
Aye.
Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yay.
Commissioner Sharp?
Yay. Yes.
Commissioner Connect?
Aye.
Commissioner Smith?
Aye.
And I as well.
Aye.
Okay.
Aye. Well.
Thank you very much. Okay. The next. Okay, hold on. The next, we've got reverberation, so I know it's hard for you guys to hear me. The next item is the approval of the consent agenda, but if you will look in your consent agenda on page 29, it's the approval of the budget amendment number 050420-13. If we can pull that out of consent, and we will need to put that, well, I just realized I messed up our letters. We'll figure it out as we go along. We need to actually put that following item C under new business. Maybe we can make that
C1.
C1. There you go. Thank you, Commissioner Smith. Because of one of the items in the budget amendment. We need to have a vote first. Okay? All right. Is there a motion to approve the consent agenda as amended?
So moved, Madam Chair.
So moved.
Any discussion? Okay. How about if there are any nays to this motion, say now. All those in approval? Aye.
Aye. Aye.
Okay.
Aye.
Okay. We'll figure it out. Okay.
If there were no nays, then everybody said aye
Exactly.
or abstained.
Exactly. Thank you. Just trying to shorten it up a little bit for those not on the board or staff, so it's less painful for them. Okay. Our next item is our public hearing, which are matters related to the financing of various capital projects. And Ms. Mentor is going to walk us through that. Good evening.
Yes, ma'am. Good evening. We have before you tonight the opportunity to hold a public hearing regarding the upcoming financing that we will be doing to fund the previously done economic development purchase of land, improvements to the courthouse and the government center here where we are tonight. As part of this, we went ahead and Davenport issued an RFP, a request for proposals for financing of the project. And you have in your agenda package a summary of that process. They did receive 5 bids. Actually, we received 6, but one of those was late, so only 5 were considered. You have a summation of the bids on page 2 of Davenport's document. The best option that came in was from J.P. Morgan, and they gave us an option of 1.03%. It is a non-callable transaction, and the best rate was for a 10-year financing. They did ask that we sign a acceptance letter within 24 hours. So Dr. Crumpton did go ahead and sign that after we verified with our bond counsel and our financial advisors that there were no consequences to us if we needed to cancel that acceptance due to either the board not approving it or LGC not approving the financing. We do have to close by June 8th to be able to get that rate. So that is who we will be recommending that you move ahead with tonight after the public hearing. So this time I'll be glad to answer any questions you may have before you open the public hearing.
Any questions for Ms. Mentor? Okay. All right. At this time, I'll open the public hearing for matters related to the financing of the capital projects for Lee County. Ms. Gamble?
I received one comment
Okay.
to read on behalf of the public hearing. This comment is from Michael Smith, who's the CEO of the Sanford Area Growth Alliance. The address for the record is 115 Chatham Street, Sanford, North Carolina. Saga is pleased to offer these comments in favor of the proposed financing plan for building improvements and economic development investment. In addition to paying for badly needed maintenance and upgrades for the courthouse and government center, this borrowing efficiently finances the economic development investment package for the Barat Forge. The Barat Forge project, now under construction, is the largest economic development project to locate in Lee County since Caterpillar in 1998. The announced investment by Barat Forge is $170 million, although we expect that investment to grow over time. The project will create at least 460 new jobs at great wages, generating an annual payroll of $21 million, the fourth largest industrial payroll in Lee County. From an economic impact analysis of the Barat Forge project completed by Crystal Morphus at Creative EDC, the construction and operation of this project will also create 379 temporary jobs during factory construction, $40.7 million in additional economic output during construction, 270 indirect permanent jobs in the Lee County area, in addition to the 460 direct jobs, $52.2 million in additional annual economic output in the Lee County area. And finally, we note that over the next 10 years, the term of this proposed borrowing, the Barat Forge project will continue to contribute an estimated $8.2 million in property taxes to the county. The Saga Board supports this proposed financing mechanism as an efficient and effective method of preparing our county and its citizens for a successful future.
Okay, thank you, ma'am. All right, any to speak against that? You said that was just one comment.
That's the only one I received.
Okay, we'll close the public hearing at this time.
Do need to ask that the board consider waiving its policy to go ahead and conduct a vote on various items related to the financing instead of waiting to the following meeting.
Okay, thank you very much. Is there a motion to waive the policy and take a vote tonight? And I will direct you to page 53 of our agenda where there is a next step schedule that Ms. Mentor's provided. Is there a motion to waive the policy?
I'll move, Madam Chair.
Okay, Commissioner Sharp, thank you. Any more questions or discussion for Ms. Mentor? Okay, this is a vote to waive the policy. All those in favor? Okay, let's just do a roll call. Commissioner Reeves?
Yes.
Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Yes for me. Commissioner Sharp?
Yes.
Commissioner Connect?
Yes.
Commissioner Smith?
Aye.
Okay. So now at this time, is there a motion?
We need to accept the rate from JP Morgan first.
Oh, okay, correct. Okay, so now we need a motion to accept the rate of 1.03% from JP Morgan Bank.
So moved, Madam Chair.
Okay. There's a motion on the floor. Any questions or discussion about accepting the bank rate on the loan? All those in favor say, well, no. Roll call, yes, I'm so sorry. Commissioner Reeves?
Yes.
Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Aye for me. Commissioner Sharp?
Yes.
Commissioner Connect?
Yes.
Commissioner Smith?
Yes.
Okay, thank you very much.
Now, if the board would consider the resolution making certain findings and determinations regarding the financing of various capital projects for the County of Lee, North Carolina, pursuant to an installment financing agreement, selecting the lender and requesting the local government commission to approve the financing agreement.
Okay, does everybody get that? I'm not even going to attempt to repeat that again, but basically it's, you know, to approve to go to the LGC with the bond, with the borrowing package. Is that a good summation?
Yes.
Okay, that's my layman's summation. Is there a motion?
So moved, Madam Chair.
Okay, thank you, Commissioner Smith. Okay, all those in favor, Commissioner Reeves?
Yes.
Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Yes for me. Commissioner Sharp?
Yes.
Commissioner Connect?
Yes.
Commissioner Smith?
Aye, Madam Chair.
Okay, thank you very much.
Thank you.
No, thank you. I still am in somewhat disbelief on that rate.
We were pleasantly
We were, that's why I didn't
surprised.
have any problem signing the offer sheet, because I figured if I didn't sign it, I might get fired.
Well, I know when you called me and told me the rate, I had to ask you, I think 3 times, because I thought my phone was messing up.
We were quite surprised
Yes.
and quite pleased, and wish we could do a little bit more right now.
Oh, man, yes, but since we're already committed to these projects, I think that's wonderful that we were able to get that rate. Thank you for all of,
Madam Chair, on
Yes.
those projects, today was the last meeting for the contractors. 12 of them came onto the Zoom platform and participated in the last call. So we started with 16,
wow.
and 12 seem to be committed to bid, and the
Oh,
bids
wow.
are due the 15th of
Okay.
May. So the architect had a lot of questions to answer, so those answers have to go back to him. So that is due back to the bidders by next Wednesday. So,
That's on the courthouse facility.
and this one, and this facility as well.
I think combining them was a great idea because it just makes it a much more profitable venture for a company. Yeah.
We have 2 local bidders,
Good.
so
Good.
we're very excited, to say the least.
Fantastic. Any more questions or comments on this particular item? Okay. We didn't really have any technically old business this evening, so we'll move on into new business. And I'll ask Ms. Gamble if she needs to walk us through this, or if you want me to do it with the property and liability.
I will.
Oh, okay.
I'm going to handle these.
I'm sorry. I know
These
she
are-
was looking at me
these are
like, what?
These are mine.
Okay, all right.
Yes, ma'am. The first item is the property and liability insurance renewal with the North Carolina Association of County Commissioners. The renewal cost was $407,828. We will apply our 2-pool discount to that, which is $15,435, bringing the net renewal down to $392,393. There is an increase from last year's premium, and that works out to about $26,000. The increase in premium is, $28,000. The increase is, we haven't had the last couple of years haven't been a very good year from a claim standpoint, and plus the value of our property that we're insuring is going up. So those 2 items together account for the increase, and be happy to answer any other questions that might come our way.
Any questions for Dr. Crumpton on the property and liability insurance renewal? Okay, is there a motion to approve?
So moved.
Okay. All those in favor of the renewal with the National Association or the North Carolina Association of County Commissioners for property and liability insurance? Commissioner Reeves?
Yes.
Commissioner Del Plazo?
Yes.
Commissioner Dodson?
Yes.
Yes for me. Commissioner Sharp?
Yes.
Commissioner Connect?
Aye.
Commissioner Smith?
Aye, Madam Chair.
Okay, thank you. And, okay, Dr. Crumpton, workers' comp?
Yes, the workers' comp renewal for the coming year with the association is $389,158. Last year's premium in workers' comp was $367,131, so there's an increase of right at $22,000, and that is completely attributable to the staff we've been adding and the estimated increase in our payroll for next year. So there was not a rate increase from the association. It was all driven by what we're doing.
Okay, any questions for Dr. Crumpton on workman's comp renewal? Is there a motion?
So moved.
Okay, all right, so we have a motion. I'll call the roll for the vote. those in approval? Commissioner Reeves?
Yes.
Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Yes for me. Commissioner Sharp?
Yes.
Commissioner Connect?
Aye.
And Commissioner Smith?
Aye, Madam Chair.
Okay, thank you very much. All right, our next item is on page 75. It's the offer to purchase 1807 Douglas Drive. Dr. Crumpton.
Yes, ma'am. I think the board's aware that we've been looking at property for the last 3 years to try to relocate some of the people out of this building that we're sitting in. And with the pending work that's getting ready to start, we really needed to move the IT department out. So after a lot of search, we have zeroed in on this piece of property. The final purchase price is not to exceed $650,000. We still have some inspection issues to discuss with the owner, so maybe we can get that below $650,000. But we have been through the building 3 times in the last 2 weeks, and our intent is to move IT and Colts to that building, and that will free up about 35 parking spaces in this parking lot to the I guess that's the south of us here, and be happy to answer any questions that the board might have.
Do you recall what the tax value is on that property?
Yes, sir. It's around $800,000.
That's good enough. That's good.
In discussion.
That is, yeah, we're getting, an adjacent lot as well for future parking expansion as well in that price. So we feel pretty good.
To approve.
Okay, any more questions for Dr. Crumpton on this?
Madam Chair, if I could ask, do we have any other properties that we can liquidate? Because I'm not a big fan of acquiring more and more and more property.
Well, the Board of Elections has asked to move over by the courthouse into the area next to probation. So when they move into that building, the downtown building that we have, what's the name of that building?
Yeah, the Ophir?
Well, it's
We call it Still Street Building.
Yeah.
Steel Street
Steel
building.
Street
Thank you.
building.
Steel Street building. I thought it was like the Woodland building or something like that. But anyway, the Steel Street building will become surplus when we're ready to move Board of Elections over there. But we really don't have much else that we could liquidate at this time.
Thank you, sir.
Okay, any other questions? We have a motion on the floor. Okay, all those in favor of the purchase for 1807 Douglas Drive at the stated rate?
Yes.
Okay,
Yes.
okay, Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Commissioner Sharp?
Yes.
Commissioner Connect? Commissioner Connect?
Aye.
Commissioner Smith?
Aye, Madam Chair.
Okay, an aye for me as well, thank you. Yeah, it's an impressive building, you know. I'm excited to see what, when General Services gets through with it. I think it'll be really, really nice, really nice. So, all right, so now that we've taken the vote, if you'll refer back to page 29 on the consent agenda with the approval of the budget amendment, and of course that included, well, some appropriations. Well, I'm sorry, we probably should do the item D2 as well, shouldn't we? I'm sorry, IT, because that's included in this budget amendment as well in that total, correct?
Yeah, but it's a separate item
Okay.
because there's a contract involved.
Oh, gotcha. Okay,
So
I'm sorry.
we
All
have
right,
to
so
do-
I'll let Ms. Minner.
Well, I'm
just
glad
trying
she
to
jumped-
get-
I'm glad she jumped up there. I thought this was going to be mine.
I'm just trying to get things
I'm
in
sorry, we're
order.
doing the budget amendments.
I'm trying to get, I really meant to ask Ms. Parrish about this before the meeting tonight, and I just wanted to make sure I got everything in order so she didn't look at me later and go, you should have voted, on this before this.
That's fine. Budget amendment number 13 includes, in addition to the $655,000 that we budgeted for the purchase of the Douglas Drive facility, which includes $5,000 for closing cost on that. There's also building improvements and some other maintenance technology and technology equipment allocated also to be able to get the building up and ready to run. And then there'll be some additional cost in next year's budget for IT, ongoing operating costs
that's right,
that
okay.
are tied to the contract that you'll be considering shortly. In addition to those, there's an additional $145,717 being appropriated from low-income energy assistance. Department of Social Services was notified that they will be having to issue a supplemental payment through that program, so that is the additional funding that will be coming from the state for them to be able to do that. And then in addition to that, there's some insurance refunds being budgeted for the Colts system to repair some vans.
Okay, thank you. Any questions on this budget amendment? Okay, is there a motion to approve?
Madam Chair,
So moved, Madam Chair.
Okay, all right, there's a motion. So roll call, Commissioner Reeves,
Yes.
Commissioner Del Palazzo,
Yes.
Commissioner Dodson,
Yes.
Commissioner Sharp,
Yes.
Commissioner Connect,
Aye.
Commissioner Smith,
Aye, Madam Chair.
and yes for me as well. Okay, item D under new business is the Windstream Network contract. Dr. Crumpton.
Yes, ma'am. As when we move into the new building, new old building. Sorry, I'm in the Granicus here. I've got to move around a little bit. We need to move fiber into the building, and Mr. Edwards has been negotiating with Windstream to get that service over there for us, and he is asking us to approve giving the county manager the authorization to execute the contract following the legal review of the contract. Windstream considers some of their items in their contract to be proprietary, and so they've asked for legal review and for us to, give me the authority to approve that. The cost, just talked to Mr. Edwards about that. If we'll sign a 5-year agreement, it works out to about $4,200, I believe the number is, a month. So if we did it for 3 years, it's like $5,200 a month. So by adding the extra 2 years, we save $1,000 a month.
Okay, any questions for Dr. Crumpton? I have one quick question.
Yes, ma'am.
So if these contracts sometimes, but if we lock in and we do the 5-year contract, I mean, we're locked in for $4,200. They can't change the rate on us for 5 years.
I'll have to review the contract when I see that.
I'm just curious.
But typically, Windstream does not have a rate adjustment
Okay.
in their contracts.
Because
But of course, we make changes, and then we come back and do amendments, and
right.
And we'll, as long as we keep doing business with them and we keep wheeling and dealing with them and extending services to certain areas,
Oh no, I think
we wheel and deal.
because that's. I mean, I was just asking because we were based on the 3 months, so that's cheaper than what's in our agenda. So that's okay.
Yes, ma'am. Well,
Cheaper's better.
we have a tough budget going forward,
Yes, we
and I
do.
have all the department heads negotiating.
Oh, I gotcha. That's what's changed. Windstream didn't call us; we called them.
Something like that.
I gotcha. Okay, all right. I just Clarification on my part. All right. So is there a motion on the floor to approve the Windstream Network contract for 5 years?
Okay, so it's different than
So
what's in
moved.
our abstract. Okay.
Cheaper, yeah.
Yeah, I caught
So
it.
moved.
Okay, we've got it. Commissioner Reeves made the motion. Okay, all those in favor, Commissioner Reeves,
Yes.
Commissioner Del Palazzo,
Yes.
Commissioner Dodson,
Yes.
Commissioner Sharp,
Yes.
Commissioner Connect,
Aye.
Commissioner Smith,
Yes, Madam Chair.
and yes for me as well. Okay, great, thank you. Tell Mr. Edwards thank you. Okay, item E, the Wumble Bond Dickinson engagement letter. Okay, so it was not an addition, it was a change in the abstract.
Well, it
Sort
was
of,
an
kind
addition,
of.
but she had already added it into the package.
Oh,
Brandon's
okay.
package.
All right,
So-
I'm a little confused. It's
okay.
no, it's fine. It's me. It's not y'all. It's me. Okay.
It's a little bit different than it used to be when we didn't have the nice system. So,
Gotcha.
we are asking you to consider, asking the board to consider the engagement letter from Wumble Bond Dickinson to serve as our bond counsel on the upcoming financing for land acquisition and building improvements. As you can see, their counsel fee will be $40,000, and that'll be paid from the proceeds of the financing. So we're just asking that that the board authorize the chairperson to sign the engagement letter.
Okay. Are there any questions for Ms. Mentor?
Is that your recommendation?
Yes, sir.
Thank you.
Okay. So this would be a motion for Wumble Bond Dickinson engagement letter for them to serve as the bond counsel for the fee $40,000, paying from the proceeds of the financing. Okay. Is there a
I
motion?
move to approve.
Okay. Okay, so there's a motion on the floor. Any additional questions or comments? Okay, Commissioner Reeves? There's a motion.
Yes.
Okay, Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Commissioner Sharp?
Yes.
Commissioner Connect?
Aye.
Commissioner Smith?
Aye, Madam Chair.
Okay, and yes for me as well. Thank you. Okay, and then wait, Ms. Mentor, just in case the next item, we'll just jump over. We'll do the budget item while you're here, so you don't have to keep getting them done. The approval of budget item number 05042014, and I'll let you just.
This budget amendment was added because of grant funds that have been received. The library received a grant for COVID funds. They are using it to buy hand sanitizer stations and to have IT construct a self-checkout station for them. And then there's also grant proceeds that have been received by the health department that they are working in conjunction with emergency management to spend those funds. And so we needed to go ahead and try to get those budget amendments approved so that funds could be dispersed and appropriated.
Okay. All right, so these are both just acceptance of grant funds, no matches. Is there a motion?
Move to approve, Madam Chair.
Okay, all those in favor say aye. Commissioner Reeves?
Yes.
Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Commissioner Sharp?
Yes.
Commissioner Connect?
Aye.
Commissioner Smith?
Aye, Madam Chair.
And yes for me as well. Okay, thank you very much. Okay, the next item is public hearing for the Biotech Center, and I'll let Ms. Parrish just remind everybody of that.
So at this time, we're just asking the board to vote to hold a public hearing with the Biotech Center. This will be money that there will be no county match related to it. It's coming from the Biotech Center to Pfizer to be used as spent for creation of jobs in Lee County and support those jobs. I've been working with the Biotech Center for quite some time, and we're looking at having the public hearing either at our next meeting in May or the first meeting in June, once we have some determinations as to where that meeting will occur. So at this time, we're just asking for a vote to hold the public hearing.
And now this is for the pass-through.
Correct.
Right.
We will receive the money and then disperse it to the company.
But
Do we know how much money it is?
Should be $100,000.
yeah, and Ms. Parrish and I have been talking. I don't think necessarily there's been discussion on whether we should have a public hearing or not, but just to kind of err on the side of caution, because we're really not expending any funds. We're just acting as pass-through, because the requirements of who receives the money and then how it's given to the company.
And this is coming from the state?
The Biotech,
Biotech Center,
which is, I believe, partially funded from the state.
I think technically they're a nonprofit,
Right, but I believe they do get some.
but they get most of their funding from the state of North Carolina for the recruitment and retention of biotech companies in North Carolina. So this 100,000 typically, I think, goes towards training of people for Pfizer up at the Biotech Center in Durham, RTP.
and I think when we had the ribbon cutting for the airport.
They have two separate arms. They have sort of an economic development arm and then a training arm. This one just happens to fall under economic development.
Okay.
Hence the
Okay.
reason why we just thought it was safe to have a public
Okay.
hearing, even though no county money.
Okay. Any more questions for Ms. Parrish? Okay, so this is a vote to hold the public hearing, and we need a preference, I guess. Do we not, on the date?
Well, if it's okay with you all, we'll just set it either on the May 18th or the June 1st. We just need to coordinate when we can get the advertisement,
Okay.
the finalized documents, and then where we're going to hold the next couple of meetings.
We should probably just do the June 1st date.
June 1st?
As long as that's okay with the Biotech Center, that would be about fine with me. Yeah.
Okay.
Give us time to make sure we get everything and get everything
Okay, that's-
advertised properly.
Okay.
But do expect a request to go ahead and vote on it that night as well.
Okay, understood. Okay, so is there a motion to hold the public hearing on June the 1st for the biotech?
So moved, Madam Chair.
Okay. All those in favor, Commissioner Reeves,
Yes.
Commissioner Del Palazzo,
Yes.
Commissioner Dodson,
Yes.
Commissioner Sharp,
Yes.
Commissioner Connect,
Aye.
Commissioner Smith,
Aye, Madam Chair.
and yes for me as well. Okay, thank you. I will brush up on my Biotech Center origins after tonight.
We probably need to too.
I don't know about all that. Okay, so manager's report.
Yes, ma'am, Madam Chairman. After our last meeting, I've been working with the department heads on putting a plan together for each department that essentially is closed right now and not operating to the public directly, how to get those programs and departments back up and running with the public over the next, in this particular case, I just pulled up Parks and Rec to give you an example. We're real anxious to try to open our parks, mainly just to give people somewhere to go and exercise without really having anything formally planned. So if depending upon what the governor does this week, we in Joseph's plan, starting next Monday, basically all our facilities would be open. There would be some limitations on using bathrooms and that kind of stuff because we don't have a sanitation plan in place. We've been talking with private companies about how to do that, and it's very expensive. So we're still trying to work through that, but just to be able to let someone go out into the open space that we have, and as long as they keep their social distancing in the space, we're going to encourage that, hopefully. And then there's a second phase where we start in his plan sometime, late May, where we start trying to get more active in some group items like baseball, softball, summer camps, gymnastics, swimming lessons, and programs, but keeping the numbers low in those groups. And then hopefully sometime late June, we would be ready to basically, hopefully get back to as normal as we can. But as we look through, as an example with Parks and Recreation's program here is, how do we have crowd control? How do we maintain, keeping our numbers low? And how do we keep things sanitized? Is the big discussion right now, and we'll be working through that through the week. So every department is trying to lay this that is currently not open to the public, trying to work through this same program to figure out how to get the program back, or public back involved. So the library today started their curbside service back up, and they went through PPE training with emergency management this morning. We're taking things very seriously in that regard, and when we're dealing with the public. But already there were a lot of people bringing books back and getting new books, and so when to open the library and actually allow people to come in the building, that's a big decision that we have to make. In the Enrichment Center, Debbie Davidson has the same issues, when to open back up. One of the things that's we're contemplating there is the VA officer has been extremely busy. He really needs to get back in the office and start seeing people face to face again. So we're going to be working on a plan this week to try to make that happen. Do appointments, make sure that we have a controlled flow of people coming into the building. On the senior services side, we went back to frozen meals today. So the participants in our meals program, about 101 people, got frozen meals for the week, and we'll be in good shape for the week. And then next week they're going to do the same. But the following week, the hope is that we can do drive-in service and start going back out to people's houses and delivering as well, so they don't have to come to us. So those are just the type of things we're working through. We're also watching the medical community with Colts to see when they start having appointments again, because then we'll have to start bringing the drivers back in bigger numbers to handle that population when they need to start moving around again. And if you think about all the doctor's appointments that have been canceled over the last 45, 50 days, and now there's got to be a catch-up, the Colts drivers will be very busy. We have put protective measures inside the vans. Basically, shower curtains are put up between where the driver sits and where the passengers sit. And they have the capability for hand sanitizing and masks and all that kind of stuff in the vans. So we're developing these plans, and hopefully we'll have something a little bit more formal by the end of the week, and work going into next week. And hopefully we'll get a little bit more guidance from the governor. He mentioned today in his call or his press conference that they're working on what phase 1 is going to look like, and he was hoping to announce it either tomorrow or Wednesday. So he's not going to wait till Friday to make his announcements. So I think there's a big hope that some things will be allowed to open up this weekend, and we feel like we need to be in a position where we're following suit, where we kind of move with that as well. So that's kind of my plan, and just talking out loud to the board. But I'll be happy to answer any questions about what's going on. We had some big numbers, relatively big numbers last week, but the last couple days the numbers have gone down. And I know the hospital is looking at trying to put a plan in place where elective surgeries and they call them the clinics, which are the doctor's offices, will start opening back up and start seeing people. So I always have told some folks that when the medical community starts going back to regular hours, that's probably a good sign. So I think, hopefully we're headed in that right direction right now.
Do you know what is our number today?
205.
205.
Today was the number.
Jamie's report was just posted.
Okay, yeah.
So that just went out right before we came over here. So our number's 205.
I'm sorry, what was the number?
205.
Thank you.
Yeah. So Heath and his folks are dealing with a lot right now, and we would like to see things slow down as well, just so we can get some of his staff some rest. And a big thanks to the Board of Education for letting the nurses come over here and help. It has really relieved a lot of stress up there, and they've been a big help in doing the contact tracing. So thank you to them.
Any questions or comments or other items for Dr. Crumpton? Okay, thank you. John, so I mean, with the school nurses, they are still able to keep up with the tracing so far?
I think they had 19 one day last week, and that was a little much for them, but they got caught up by the weekend, and then we've had low numbers over the weekend, so and today wasn't a big day either. So hopefully the numbers are headed down, but like I said, they're Jessica and her nursing staff. They've done a bang-up job.
Yes, they have. Do we know? I know it's different for each individual that tests positive, but is there sort of an average number of how many contacts they have to make for a person when they do tracing? Somebody's asked. I've had that question several times, and I said, I don't know, it could be 10, it could be 50. It depends on the person, right?
I have not asked that. I've let them do their contact.
we
let
probably
them take care of that. I've tried not to get in the way of that.
Understood.
But
we probably don't want to know how many calls they're having to make.
I just don't want to interrupt what they're doing. Tell them to stop. Hey, I need some numbers. But Heath would have to release those numbers, and and I'll be honest, there's been a lot of discussion about what can be released and what cannot be released. And I did ask the Association of County Commissioners last week to put a team together to figure out, why we're not consistent across the state.
Yes.
Why DHHS has given the health directors some direction, and then they've released information that they told the health directors, they couldn't release. So
right.
I just think the lack of consistency has created some angst, not only from the media but from our citizens, because we still get calls. Mm-hmm. We had one today. We had one this morning where a person was very angry that for some reason he wanted to know what the real death toll was, and when we told him 1, he disagreed with it and was really upset with the person he was talking to. So it just seems to be a lot of angst out there, and that's the only term I can use. And sometimes being able to give them a little bit more information is all they need, but telling them that we've had community spread and that it can be anywhere out there just doesn't seem to be good enough. And I wish it was, but it's not.
Well, one of the things for those people watching or listening is we as board members can't tell you something we don't know. And just like Dr. Crumpton and our staff, HIPAA laws are serious business. And, when somebody tests positive and that's reported to our health department, we don't know who they are or where they work, or the demographics that you've seen in the paper recently as far as the age breakdown in male and female is all we know. I understand when people call me and say, my parent is at this rest home, do you know if they have any cases? Or one of my family members works at this business, do they have any cases? We don't know. We're not given employment information by the health department or the state. So it is frustrating. So again,
and the public should know that, you know, the health director is, you know, he's consulting with a lot of different people about what he can and cannot release. So if he, you know, if that was information that legally he could release, he would. But
yes.
You know, when you have multiple sources giving you the same piece of advice, you know, you're going to follow it.
Have to follow the law.
That's
Except
right.
the media.
Pardon?
Except the media.
Well,
You know, WRAL will do a you know, scare the face of the individual and go on there targeting certain industries and such.
Well,
I think it's, you know, if the person that tests positive wants to talk to the media, that's their right. Yeah, but we can't
Yep.
say, you know, we nor do we have, you know, information to that regard. Any other questions or comments for Dr. Crumpton?
No.
Okay, Commissioner comments then. Commissioner Reeves.
Yeah. Everybody, please be safe. Take care. Thank you.
Okay, Commissioner Del Palazzo.
Yes. So this past week, the Lee County Partnership for Children and Families met virtually, and there were a lot of things to cover. One of the things that was mentioned in the meeting is there are multiple child care facilities that are open right now to essential workers and their children, and some of those facilities are in desperate need for sanitation items, along with some other things that are listed on their website, the Lee County Partnership for Children. So there's a link there where you can drop off some supplies. And they're also doing a program right now for our seniors who, you know, graduation has greatly changed. And so there's an Adopt a Senior program where you can kind of spoil one of our seniors this year. So I just wanted to make both of those things known, and links to both of those areas are on the website for the Lee County Partnership for Children. Thank you.
Great. What a great idea. What a great idea. Dr. Brown was talking earlier about the senior class of all of our high schools in the county. So that's a fabulous idea. So link to the Lee County Partnership for Children. And they'll have links on there if anybody's watching or listening to participate in the Adopt a High School Senior program. And then also our child care facilities that need PPE supplies, basically. I would guess Clorox wipes and disinfectant spray and hand sanitizer and that kind of thing. John, you know,
yes. If you want to drop any of those things off, they're taking the donations for that at Books at a Steal.
Okay.
Wednesday through Friday from 2 p.m. to 5 p.m. and Saturday from 1 p.m. to 4 p.m.
Okay. At Books at a Steal on Steele Street, you said
yes.
Tuesday through Friday?
Wednesday through Friday.
Wednesday through Friday, 2 to 5?
From 2 to 5, and then on Saturdays, 1 to 4.
Okay, Books at a Steal on Steele Street, Wednesday through Friday, 2 o'clock to 5 o'clock, and Saturday, 1 o'clock to 4 o'clock.
Yes, ma'am.
Okay, just encourage everybody to do that. You know, if you those things are so hard to find. I mean, I've just been looking for our family, you know, yeah. So and what makes it harder, I guess, is you're only limited most of the time to getting one, sometimes two, when you go. So if you run across, and they probably also need toilet paper and paper towels as well. So, you know, if you're able to pick up an extra and can drop it off at Books at a Steal, or look on Lee County Partnership for Children's website, because I tell you, you know, all of our essential workers, you're thinking about folks at the hospital and our EMS and police and fire and grocery stores and pharmacies and that kind of thing. Yeah, we need to help those facilities out if we can to keep those little ones safe. Okay, thank you so much, Ariana, for that. That both important things we need to work on. Commissioner Dodson.
I'm good, thank you.
Okay, Commissioner Sharp.
I'm good as well.
Okay, Commissioner Connect.
I'm good, thank you.
Commissioner Smith.
Madam Chair, just to remind everybody, maintain your physical distance, and if you got a cough or sneeze, cover it. And please get out, order out if you can, and support our restaurants that are at least struggling to survive.
Yes, thank you. Commissioner Smith and I were talking before the meeting that we both frequented a Broadway restaurant on Friday, and I had kind of the same idea. That's so important. And I just have a brief but terribly sincere plea for everybody that's watching and listening. You know, we all want to open our businesses back and get back to this new normal that we're going to be in for a while, but it's critical that we are able to do that. But at the same time, you know, we have got to follow the recommendations as we are comfortable doing. I know we had the discussion for the last couple of meetings about face masks, and I'm certainly not in favor of mandating that people wear face masks, because I understand that some people, you know, do have issues with that, and I get that completely. But I was at a business a few days ago, and I can't tell you how uncomfortable I was because someone without a mask reached over my shoulder to get something when I was, you know, and I wasn't taking a long time to get my purchase. They were just very impatient and couldn't wait the maybe 10 seconds it took me to find what I was looking for on the shelf and pick it up and move 6 feet away from them. Folks, the only way this is going to work is if, like Commissioner Smith said, you know, we keep the 6 feet, where at least, you know, if you're not wearing a mask, please keep at least 6 feet. Because, you know, you're not taking care of yourself, you're taking care of all of us, you know, in the way we behave. And I've heard several doctors and governors, you know, kind of share this, that, you know, when you go out without a face mask and you don't keep that social distance, and you have COVID-19, but you don't know it yet, and you breathe on somebody, or, you know, sometimes you have a cough or a sneeze come on you and you don't have time to cover because it just kind of comes on you in a hurry, and you make that person, you know, 2 feet away from you, or that you're reaching over, you make them sick. Well, they may not know it for a while, and they take it back home to them, to their family. They're sick, members of their family are sick, and then before we know it, our hospitals start getting overrun again, and we have to shut back down. Because again, remember, the reason why we shut down like we did was to flatten that curve so that our medical, our hospital, our doctor's offices, so they're not overrun, and we don't just literally run our medical folks into the ground. You know, we've all seen the stories in these places that have the hot spots, where it is becoming detrimental to these doctors and nurses and other medical professionals and what they're having to deal with, and they're gonna have some lifelong lasting scars over this, and we don't want to do that to our folks around here. So please, 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 so when we do open, we can stay open. Let's remember that it's weird, I know, and it requires patience. That was another problem in that particular store. The arrows, you know, you go down one aisle and you come up another one, and I saw just a whole bunch of people. They saw what they needed just 5 or 6 feet down the aisle, so they didn't want to, you know, go up the next aisle and come back down like they were supposed to. So they were crisscrossing back and forth. And folks, it's this organism doesn't care who you are or where you are, or, you know, it's just looking for human bodies for hosts. So just please be careful. And as we open up, let's remember that 6 feet or more, wear a face mask if you're comfortable, wash your hands, get hand sanitizer when you can, so we can get back to being together in person more. It's important, folks. That way we can get through this if everybody just works together and takes care of one another. So is there a motion to adjourn?
Aye.
Okay. I was beginning to wonder if everybody left except for Commissioner Smith and I. Okay, there is a motion to adjourn. All those in favor, let it be heard by saying aye.
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 Okay. All right. Thank you very much. Y'all stay safe. Take care.
It was a long